An initial assessment is the name given to the first type of appointment that the majority of our patients come to us by. Typically it's a 90-minute appointment, and you would see a specialist audiologist whose specialism is in the treatment of tinnitus, hyperacusis and also hearing loss. And really the best way to imagine it is it's got a twofold purpose. The first is from the audiologist's point of view. So we want to find out as much as possible as we can about our patient's tinnitus. Things like what sort of pitch is it, what does it sound like, where do you hear it, how long have you had it for, and when does it bother you most. We will talk about whether there's any increased sensitivity to sound, known as hyperacusis, and also whether there are any hearing issues. If any one of these isn't relevant for you, of course we tailor the appointment to the specific problem that you've come for. We check the physical health of your ears as well, so that would include having a look in, a pressure check to look at the status of the eardrum and the middle ear. Then we'll do a hearing test which will look at the whole system and then start focusing in specifically on the tinnitus or the hyperacusis. The second purpose of the assessment is for you as the patient to have as much information given to them as possible. So we talk through the results and what the implications are. What tinnitus is, what causes it, what causes hyperacusis, and build up a clinical picture of what exactly is going on with your particular auditory system. On the basis of that, we'll go through the management options that are open to you, and that can be anything from just conservative tips to help you manage on a day-to-day basis that you can take away straight away, or it may be a structured management plan which is required. Of course, if it turns out during the appointment that you need any onward referrals, such as a visit to the ear, nose and throat doctor, or to see your GP for additional support, we'll help to arrange that as well. One of the most common points of feedback we get from our patients is that they appreciate the amount of time and the availability of the expertise from the clinic to help them manage their tinnitus better, and just to feel better informed is a big step along the way. And that goes towards helping improve the overall quality of life.